Yes, there is good data now. There have been a major screening initiatives going on at several large institutions. University of Minnesota, Sloan Kettering are probably into their 20th to 30th year of people undergoing screening. And other than patients who develop an index cancer at the time of their initial procedure, patients who have participated in the screening, the incidence of cancer is almost approaches 0%. I mean, it's very rare. We have seen a drop in the incidence of colon cancer in the last 10 to 15 years, and we believe one of the major reasons for that is that more and more people are availing themselves of screening. I should point out here that unfortunately, because of fears regarding the possible pain of procedures and possible complications, and colon cancer has always been called the cancer no one wants to talk about, that only about 30 to 40% of the people who are eligible for screening are availing themselves of this service. So one of our goals is to really get the message out there that the people need to come in and get screened. People who, worst case scenario, if you go through screening and we find a cancer, it is curable 90% of the time. If you wait to develop a symptom and then go to your doctor and are found to have cancer, the cure rates drop to 40 to 50% of the time. But even more important than that is the detection of polyps. We believe that most cancers do not arise de novo in the colon. In other words, you don't go to bed Friday night with a normal colon and wake up Saturday morning with cancer. That almost all cancers begin as a benign polyp, and it takes up to 10 years in most cases for these polyps to turn into cancer. So we have this beautiful interval of 10 years to get in there with our colonoscope and remove a polyp. So not only are we finding early curable cancers with screening colonoscopies, but we're preventing cancer by taking precancerous polyps out of patients. The current recommendation is that patients begin screening at age 50, and assuming nothing is found, they can then return in 10 years. If we find polyps, we usually have them come back at 3 to 5 year intervals for subsequent colonoscopies, because these people have now been defined as being at a higher risk for colorectal cancer. Patients with a first-degree family member with colon cancer should begin screening at age 40 rather than age 50, and they are generally recommended to be screened every 5 years. Screening usually continues till at least at age 75. If you've had a normal colon at 50, 60, and 70, probably you're not at risk for getting colon cancer and don't need to be screened past the age of around 75 to 80. I think there's no question about that.